Hello, I am Dr. S. Mishra. I am a dental surgeon and I welcome you all to our channel Now Ask the Doctor. So, Government of India has issued a recent guideline on 28th June 2021 regarding the administration of COVID-19 vaccines in pregnant women. Previously in India, the COVID 19 vaccine was contraindicated in pregnant women. See, this whole coronavirus territory is very much new, and the vaccines are also new, and the initial phases of trial are not performed in a pregnant woman. That's why the vaccination was contraindicated in a pregnant woman so far. On 28th June 2021, Union Ministry of Health issues guidelines for vaccination of pregnant women. According to the guidelines, COVID-19 vaccines available are safe and the vaccination protects pregnant women against COVID-19 illness or disease like other individuals. Now, there are a few points in the guideline. I will discuss them in detail and tell you what they are suggesting or advising. For better understanding and for your ease of understanding, I will discuss these points in a question answer form. So, let's begin. And the first question is, why is the COVID-19 vaccine recommended for pregnant women? So, according to the latest guidelines issued by the Union Ministry of Health, most pregnant women will be asymptomatic or they will have a mild disease, but their health may deteriorate rapidly and that might affect the fetus too. It is very important that they take all precautions to protect themselves from acquiring COVID 19, including taking the vaccination against COVID 19. It is therefore advised that a pregnant woman should take the COVID 19 vaccines. Now, the next question, who are at higher risk of getting infected with the coronavirus? So, the following persons are at higher risk of getting infected with coronavirus. Number one, someone who is a health worker or a frontline worker. Number two, community having a high or increasing rate of COVID 19 infections. Number three, those who are frequently exposed to people outside their household. And number four, those who find difficulty in complying with social distancing if living in a crowded household. Now, the next question, how does COVID 19 or coronavirus infection affect the health of a pregnant woman? So, let's discuss. So, although most, that is greater than 90% infected pregnant women recover without any need for hospitalization, but rapid deterioration in health may occur in few. Also, symptomatic pregnant women appear to be at an increased risk of severe disease and even death. And in case of severe disease, like all other patients, pregnant women shall also need hospitalization. Then pregnant women with underlying medical conditions like high blood pressure, obesity, age over 35 years are at a higher risk of developing severe illness due to coronavirus infection. Now, the next question is, how does COVID 19 infection in pregnant women affect the baby? In most of the cases, that is over 95%, newborns of COVID 19 positive mothers have been in good condition at birth. But in some cases, COVID 19 infections in pregnancy may increase the possibility of premature delivery. The baby's weight might also be less than 2.5 kg. And in very rare situations, the health of the baby might deteriorate before birth. The next question is, which pregnant women are at a higher risk of developing complications after COVID-19 infection? So, pregnant women who are older than 35 years of age, obese, have a pre existing illness such as diabetes or high blood pressure, and have a history of clotting in the limbs are at a higher risk of developing complications after coronavirus infection. The next question is, if a pregnant woman has already had COVID 19 infection, then when should she be vaccinated? In case a woman has been infected with COVID 19 during the current pregnancy, then she should be vaccinated soon after delivery. The next question is, are there any side effects of the COVID 19 vaccines that can either harm the pregnant woman or her fetus? So, according to the guideline issued by Government of India, the COVID 19 vaccines available are safe and vaccination protects pregnant women against COVID 19 illness or disease like other individuals. Like any medicine, a vaccine may have side effects which are normally mild. After getting the vaccine, some can get a mild fever, then pain at the injection site, or feel unwell for 1 to 3 days. Now, the long term adverse effects and safety of the vaccine for fetus and child is not yet established. Very rarely, the pregnant woman may experience some of the following symptoms within 20 days after getting the COVID 19 vaccination, which may require immediate attention. The symptoms are shortness of breath, chest pain, persistent abdominal pain with or without vomiting, pain in limbs or pain on pressing the limbs, a swelling in the limbs, small pinpoint hemorrhages or bruising of the skin beyond the site of injection. Now, the next question is, what other precautions need to be taken after a pregnant woman gets the vaccine? Even after completion of vaccination, pregnant woman and her family members should continue practicing the COVID 19 appropriate behaviors such as wearing proper mask properly, then maintaining physical distance and avoid going to crowded places, then practicing frequent hand washing. Then the last question, how will a pregnant woman register herself for COVID 19 vaccination? The pregnant woman need to register themselves on the CoWIN portal or may get themselves registered on site at COVID 19 vaccination center. The process of registration for pregnant women remains the same as of the general population. That's all. If you ask me my personal point of view whether pregnant women should take the COVID 19 vaccines or not, I will highly recommend you to consult your gynecologist and to trust only them regarding this issue. Your gynecologist will consider your risk benefit ratio, your underlying health conditions, and if they suggest you or advise you to take the COVID 19 vaccine, then you should definitely consider the vaccination. If you find our video informative, then please subscribe to our channel. All our videos will definitely make you more aware of the current situation. Thank you. Stay healthy and stay safe.